My name is Colleen McGrath. I am a PhD candidate in the Population Health Sciences PhD program, specifically in the epidemiology field of study, and I'm part of the Cancer Epidemiology and Prevention program. So I came to the field of cancer epidemiology from personal and family experiences with cancer in my family. When I was in 8th grade, my mom was diagnosed with stage 4 lung cancer. At the time of her diagnosis, she had metastases to her brain and she was given a pretty grim prognosis, but she was a very positive person and stayed very motivated despite this. And because of this, she defied clinical expectations and survived for nearly 5 years beyond her initial diagnosis. I remain extremely grateful for those extra 5 years together. And so during this time, I was her primary informal caregiver, and I became very well acquainted with the survivorship experience. It was a very difficult time with many ups and downs, with changes in her treatment, physical and mental effects that emerged, changes to her quality of life. But being her caregiver and seeing her cancer journey is something that I carry with me to this day. I also became heavily involved with volunteering and advocacy in the cancer space, specifically with the American Cancer Society. This started off as a supportive outlet for both of us, but it turned into one of my life's passions, something that I'm still heavily involved with to this day. And seeing the stories of cancer survivors and their caregivers in this capacity is something that has really shaped me. So I knew that I wanted my life's work to be somewhere in the area of helping families like our own who are impacted by cancer. At first, I thought this meant that I had to be a doctor and practice oncology, and so my undergraduate training started off in the pre-medicine space. But through fulfilling one of my general education requirements, I took a public health class, which was a field that I had never really heard of until then. But I became very quickly enamored with the field and took another class and another class. I eventually ended up in an epidemiology class, which was another word I had never heard up until that point. And I became drawn to population level health and the importance of data-driven work. I learned that public health and epidemiology could allow me to make important contributions to the lives of patients and families impacted by cancer at a very large and population level. So many years of fielding different areas from nonprofit to pharma to clinical research, I eventually found my way to academic-based data-driven research in epidemiology and really found my passion. And so I hope to achieve a research career in cancer epidemiology where I can provide insights to support patients and families that are impacted by cancer on a population level. So I actually used to work down the street at Beth Israel Deaconess Medical Center doing clinical research, and on my walk from the T to work, I would pass the Kresge building and the Harvard Medical School campus, and I would think to myself, in my wildest dreams, maybe one day I'll be there. And so when I was applying initially for my master's programs in epidemiology, I thought HSPH would be a long shot, but I applied anyway, and somehow, some way, I was accepted. And in weighing all of my options, really nothing shaped up against HSPH. The cancer epi curriculum is unmatched to other schools of public health, and I know the breadth of resources that would be available to me to study cancer in a city like Boston, with its impressive network of academic centers and hospitals, would really be unmatched. By some stroke of luck, I was paired with the absolutely wonderful Lorelei Mucci as my academic advisor for the master's program. And in the 2 years that I was in this program, Dr. Mucci taught me so much about epidemiology, cancer, how to conduct academic research, how to be a supportive leader, and so much more. She empowered me to become very confident, allowing me to lead the design and conduct of my own independent research projects, even at the master's level. And she's just been an exceptional mentor who provides so much academic and personal support to each of her mentees. And I know how important having a good mentor is for the next step of my career, which was the PhD. And I couldn't imagine someone better than Dr. Mucci. So by some second stroke of luck, I was admitted to the PhD program and have been able to work with Dr. Mucci and her genitourinary cancer lab group since. So my research interests are in cancer epidemiology, specifically focused on the survivorship stage of the cancer care continuum. This is, of course, motivated by my personal experiences in my family, being my mom's primary caregiver during her cancer journey, where I became very well acquainted with the survivorship experience. The population of cancer survivors is large and expected to continue to grow in size. So more and more individuals are living for years beyond their cancer diagnosis, in part due to advances in treatment that allow folks to live longer. And so the survivorship stage is becoming an increasingly important and recognized part of the cancer care continuum from clinical and research perspectives. Survivorship is characterized by treatment decisions, impacts by treatment that are kind of both social, so things like financial toxicity, to treatment-related side effects that are physical and mental, physiologic changes from the cancer itself, quality of life impacts, and much more. And so I'm working towards understanding how we can improve the long-term survivorship experience for cancer survivors. I specifically focus on prostate cancer survivors in my dissertation work, and I'm interested in both hard outcomes, so things like mortality and morbidity, specifically cardiovascular disease, as well as softer outcomes like quality of life. So one of the most impressive and unique parts of studying at HSPH is the vast opportunity for connecting with so many experts in countless fields. The faculty at HSPH themselves are the world's leading experts in their respective areas of study, and you have access also to researchers and clinicians at the neighboring institutions like Dana-Farber Cancer Institute and Boston Children's Hospital, both right down the street, Massachusetts General Hospital, Harvard Medical School, and so many other really impressive institutions. Many of these researchers that are at these institutions have joint appointments at HSPH or are just generally extremely open to work with students, including serving as thesis advisors on dissertation committees. It's a really rich opportunity to collaborate and expand your network, as well as learn from others and be able to engage in so many different fields while you're here. One of the other things that really struck me when I started at HSPH was how open faculty were to meeting with and working with students. Consistently, faculty members respond to each and every student inquiry just to meet and simply discuss their research. Obviously, the faculty are extremely busy here, but they always make time and prioritize the students over everything else. Whether it's a quick one-time meeting or to serve as a secondary mentor or bring them onto a research project based on your shared interest, or even to connect them with a colleague who might be a good fit for them, the faculty are always open and really do prioritize meeting with and connecting with students, which is really, really great. Another thing I quickly realized about the academic environment here was the really collaborative nature among the courses and student networks. Student groups are a really important part of the culture here at HSPH. In particular, study groups is another big part of it. Through my core courses, when I had study group sessions, that's actually where I met my closest friends here. We reviewed homework together, attended office hours together, did countless group projects together, and eventually really strong and genuine friendships bloomed from that. And that's because of kind of the way that the study group network and environment here at HSPH really fosters that and allows students to work really closely together. And I think that also holds true for research group meetings. Most students here are involved in some research group, and so it provides a really supportive and collaborative environment. Yeah, so a typical day of a student studying cancer epidemiology here. It definitely varies depending on what stage of the program you're in. In the first few years, your day-to-day is filled with classes. The first few semesters, you're taking your core epidemiology classes like study design, causal inference methods, and biostatistics. You'll also be taking your core cancer epi classes. In the later semesters, you start to specialize and take courses that you're interested in and might be relevant to your research area, methods that you want to learn to apply to your research area. As you move further into the program, another big component of your experience in the day-to-day is through teaching with teaching fellow positions. This has actually been one of my favorite parts of my experience at HSPH. I've gained so many new and unanticipated skills through teaching. It's allowed me to grow more confident in my public speaking. It's enhanced my understanding of epidemiology, as when you teach things, you learn a lot of different nuances. I've also gained a greater appreciation for the field of epidemiology as a whole from working to get students to be excited about it and find ways to make the concepts and methods click for different types of learners. And between classes and teaching, especially in the later parts of the PhD program, research is another vital component of the day-to-day experience. For me, that looks like anything from working on code for one of my projects, working on a manuscript or poster presentation, workshopping project ideas or troubleshooting questions in my group research meeting. There's no shortage of research opportunities here, and it's something that I've been very fortunate to be involved with since the very beginning of my master's education here and now throughout the PhD program. Finally, another important part is kind of the social experience. So there are a number of student events and groups that are an important part of the day-to-day. I'll just speak on one group. So one group in particular is the John Grant Society, Harvard's Epidemiology PhD Society. It's a group that provides student support and organizes academic and social events for students. We have career panels, student panels ahead of major qualifying exams, journal clubs, and so on. And this is just one example of the many student groups that you could be involved with. When I was looking at various different cancer epidemiology programs, one thing that stood out to me was the broad array of cancer epidemiology teaching and coursework that was available at HSPH, much more than any other school that I looked into. You can take everything from the Epidemiology of Cancer, which is an excellent introductory course to the major topics of cancer epi, taught by experts Lorelei Mucci and Ed Giovannucci. You could take a global cancer epi course to get a more global outlook on the field. You could take nutritional epi of cancer, which is a really unique class that dives specifically into diet and physical activity, which we know are major contributors to cancer risk and survival. There's also a course entirely focused on biomarkers in cancer epi, and so many more. No other programs that I looked into had such a wide array of offerings just within the cancer epidemiology track, and this is true across the board for other tracks of epi. Another really unique part of the program here is the data available to you. At Harvard, there are several long-standing large cohort studies of adults and even a cohort of children that collectively have decades upon decades of data. This provides a really rich resource to study cancer in particular. As we know, cancer can take years or decades to develop, and so investigating risk factors requires a lot of data that takes years and years to collect, which is no easy feat. At HSPH, though, you have access to these really rich resources to conduct cancer epidemiology risk factor studies. For me, this also means that there's decades of follow-up on individuals that have chronic diseases like cancer, which provides another really rich opportunity for survivorship research that does not really exist in many other places. So not only do you have access to these really rich data, you also have access to the people who run these cohort studies, which provides both their substantive and methodological expertise, but it also provides an opportunity to gain insights on how to conduct and operate studies of this scale, which is really important if you're interested in being an investigator yourself, like I am. All around, I think it's a really rich opportunity for learning for both academic research and conducting cancer epidemiology studies.